In a simple way, Shifamed is sort of a factory of medical device startups. We like to start medical device companies, establish them, get them up and running, fundraise for them, operate them, and get to the point where we have clinical evidence so that, potentially we can do a transaction. And then we really creating value, getting those products in patients, which is the most important. We have 8 companies in the portfolio. We have 5 cardiovascular companies. That's sort of historic. This is where I started my career. A lot of our network is really around cardiovascular. Also, it's one of our biggest sectors in our industry. We have 2 ophthalmology companies and then 1 enterprise software solution company that's really catering to the medical device industry. Since I was a young person, I was interested in medicine, thought of being a physician at one point, but biomedical engineering was really sort of where it fell for me, and it worked out. That's what I studied. But I ended up, by chance, working for a company called Advanced Cardiovascular Systems, part of Eli Lilly, which eventually became Guidant Corporations. And then I joined a startup called Cardiothoracic Systems. We were doing beating heart surgery, very exciting. We were one of the first ones to do beating heart surgery products. We went public really quick, commercialized the product. So learned a lot from that, and then started my first company. And that was consulting for various folks. Ultimately, we designed the filter wire. It was really on behalf of Fredko Stravi. Then that led to another startup that I started, which was Sadra Medical, which was a percutaneous aortic valve company that also got acquired by Boston Scientific. By the time I was doing the second one, I found myself really repeating the same things of establishing the basic infrastructure of, where do you set up your facility? You started in a home, but ultimately you have to spend a lot of time figuring out who's going to be your CFO, who's going to do the part-time support for human resources, a variety of these functions that really didn't have anything to do with the product, but they're essential to running a company and having a team, to fundraising, facilities, and so forth. And I found myself repeating and spending a lot of time doing that. And at a time in those early formative months when you're competing with others, you may not know who they are, but if you're thinking about it, others are thinking about it. And I really wanted to not spend so much time establishing basic functions of, how you run a company and put a roof on the head and so forth. So that's really where the idea came from, to establish Shifamed, so that we would have a permanent infrastructure that's useful for the startups, not necessarily something that the acquirers, the large corporates, would need, because they have plenty of human resource people or finance and accounting people and so forth, that we will be able to repurpose and leverage for every startup that we do. That was really the idea of Shifamed, is essentially create that ecosystem that enables startups to quickly move, quickly go from an idea to a prototype to a patent filing to conversations with physicians to a business plan and a fundraise. In medical devices, you have significant regulatory burdens, reimbursement burdens, clinical trial challenges, and so forth. So the amount of funds that you have to raise are, dramatic. And the time that it takes to get certain of these things done is also elongated, and makes the challenge that much more. So if you've succeeded before and if you have a track record, it's a lot easier to go and raise money again and do it over again and succeed. For a first-time CEO, it is super difficult, and that is a challenge of our industry. So people in our industry are mostly dedicated, passionate about what they do. This is sort of their life goal. And then you tend people, that's the kind of people that gravitate to our industry. But it is not an easy environment. But I think ultimately good ideas win out, sometimes in tortuous long pathways. I think that the next things that we're going to do is really going to be on the intersection of the typical invasive, minimally invasive products that we develop or implants, but in combination with, the digital world, the machine learning, the AI, and so forth. So that's really where we're focused and where we want to go. But that's really, I think we're going to see a lot of interesting things that couldn't be done before.